Hello everyone. Welcome to this presentation on the writing assessment criteria for the occupational English test. This is Muhammad Gamal, the presenter, and I'm going to show you on this presentation the format of the test and then how the criteria have been updated recently. They started actually to be in use on August 31st. So let's start first with the format. So the first thing you will find here that it's a formal letter and it's usually a referral letter. It's on a medical matter and the body is approximately between 180 and 200 words. And by the body, I mean it's between the start of the letter, like the date and the name and these things, and the closure of the letter, like your name and signature and these things. Also, the test is 45 minutes long. The first 5 minutes is for reading, and you're not allowed to write or circle anything. And then you have 40 minutes to write the details. And to write the details, you are provided with case notes. It's like a table with some notes about a case. You read carefully these notes in the first 5 minutes, and then you start writing about them. Like what we said, you are not allowed to underline or circle any keywords or information during the first 5 minutes. However, you need to select the most relevant information. And here you need to focus in the first 5 minutes, and you need to also pay attention that invigilators will not allow you to pick up your pencils or pens or erasers to do any kind of action. So you need to have some kind of focus and concentration to be able to start directly writing after the 5 minutes end. There is no specific template required, just to choose one which is suitable for the response and you feel comfortable with. And the reason for this is that we can say that there is no special format or a specific format for letters in New Zealand or Australia or UK for the hospitals. So you can find different layouts, just find the one which is suitable and it will be fine. Medical terms or abbreviations can be used only in case it's written to a healthcare professional, and we will talk about this later. But you need also to pay attention to the person you are writing or the audience you are writing the letter to. If it's written to a healthcare professional, so this means that you can use abbreviations, however, not like too many. Or if it's written to a carer or a parent or somebody else who is not a doctor or a nurse, so you can use lay language, which doesn't contain any kind of medical words or terms. Concerning the layout of the case notes, you will find it's like a table with some notes about specific case. You can find different information about maybe the status, marital status, the social background, if there is any kind of disease or any family member who caught a disease before, if this person is still under treatment or everything is okay. Like what you see here at the end, you can find the discharge plan, discharge to rehab facility, for example. So it's like um, some notes about a case, and you need to select what is important or relevant during the first 5 minutes to be able to write about in the following 40 minutes. Now, with the assessment criteria, we said that we can divide them into two sections. The first section is before August 2019, and you will find that they were worth 30 marks in total. Uh, 5 sections. Each section is out of six. They are the overall task fulfillment, appropriateness of language, comprehension of stimulus, linguistic features, and presentation features. And after discussing these five criteria in details, we will see how they have changed and whether this affects the difficulty of the exam or no. So let's start first with the overall task fulfillment. And we mean by this appropriate response. Is it um, appropriate or no? And we say here it's usually between 180 and 200 words. However, the count or the number of words is not that important. So if you write less than the number of words is fewer than 180 or a little bit more than 200, it's okay. No worries. Once it's appropriate and enough, no problem about this. Also, you need to make sure that you cover what is required in the letter. So, if the letter asks you to write about two, three, four bullet points, you need to make sure that you cover all of them fully and appropriately without omitting any of them. So here an example, like if you are writing a letter of discharge, you must make sure that it states that the patient is being discharged because this is required. If you will not show it, so this means you will lose marks. Another criterion, which is appropriateness of language. And with this, we mean that do you organize the letter clearly? And also, do you highlight the main purpose at the start? So notice here, it's not about starting with a topic sentence or introduction, then followed by the body, then followed by conclusion. No, here you need to state from the very beginning why you are writing this letter and what kind of important information do you need the doctor or the other person you are referring the patient to look at. You need him or her to look at the historical background first, the medication that he or she takes. What what do you want them to look at? This should be clearly stated at the beginning. Also, you need to be clear about the level of urgency. So, is there any kind of emergency or urgency in this letter? And this will affect the language, as we will discuss later. This will affect the language and the structure used. Okay, so you find yourself choose some kind of vocab or some kind of structure to show the person you're writing to that this is urgent. Also, make sure that the register is suitable for the situation, and by the word register, we are talking about level of formality and technicality. It's a letter to a doctor, it's a letter to a workplace doctor, so you need to pay careful attention to the language you use. Okay, so write in a formal style, avoid abbreviations and informal words, except in some cases for abbreviations, but informal words are not used or are not allowed. Comprehension of stimulus, and by stimulus we mean the reason of writing, why you are writing this letter, and this can be demonstrated through some points. So you you understand the case notes? Do you understand the question? So simply it will show in choosing the relevant notes. You understand the purpose or reason for writing by stating it clearly at the beginning. Stay understanding who they are writing to and why by using the language and stating this at the very beginning before starting the body paragraph or the body of the letter, I mean. You make clear connections between the notes. So maybe you are mentioning, for example, the background of the disease, for example, or the family background of the disease, and then how this, like, let's say, what affects the case, and then you move to some points or marks or notes you would like to mention, and then if you have any suggestions, so you move smoothly between these points or no. And also, do you pose questions to the reader, I'm sorry, if necessary? And by this, we also need to pay attention to something, that questions are not allowed in a letter. No question marks are allowed. So whenever you make a question, make sure to use indirect questions. So instead of saying, what, let's say what, when do you think the patient should get out, for example, or this be discharged? You can say, I would like to know when the patient can be discharged, for example. or instead of asking for some kind of medical plan, maybe. So instead of saying, "Can you provide me with a medical plan?" you can say, "I would like you to provide me with medical plan," something like this. And any errors in any of these areas will make you lose marks, because simply it means you do not understand the reason or the stimulus of the reading, sorry, of the case notes or of the question itself. And now with the linguistic features, and as the name suggests, it's about using the language. Can you use the language accurately and flexibly? It doesn't mean that you show many grammatical structures, but it means to show like sound grammatical ability, which is acceptable. Also, can you use a combination of complex and simple sentences appropriately? And again, it's not about how many of them. It's about um, you can use them effectively or no. They can help you to deliver the meaning clearly and directly or no. Remember that you may write to somebody who is not in the medical field. So again, this is very important to pay attention to. Again, no set limit of grammatical errors allowed. It's mainly about are they minor or major. The last one with the older criteria is the presentation features. And by this we mean using punctuation correctly and avoiding spelling mistakes. It's very important. Clearly spacing paragraphs, and there is a recommendation here that you leave one line gap between each paragraph and the following one. Also, they use a clear formal layout. Again, remember that there is no one specific layout for any letter. It's just using a suitable one for the response and one that you feel comfortable with. And again, make sure that you use a clear handwriting. It's very important. Be consistent with the spelling, American versus British. So it's okay to use any of them, but do not try to like jump from this to this. You use a word from American style and then you add another word from British style. This cannot work. And you avoid symbols and abbreviations, except of course if you are writing to a medical professional, and in this case again you are not advised to write many of them, and you are not advised to use notes in your writing. So for example, the first part here, patient BP is without is even patient BP 120 over 80. This is not okay, but you can say patient's BB was 120 over 80. This can be okay and acceptable because it's in a sentence format, and this is what you need to write about actually. Okay, so this is for the old criteria of the writing assessment criteria. So we can move now to the new one. Okay, so with the new criteria, you will find that we have six of them, and they are more specific. They are not that general like before. You find the purpose, content, conciseness and the clarity, genre and style, organization and layout, and the language. The scale of the marks is also a little bit different. So you'll find that the purpose is marked on a scale of 0 to 3. It's out of 3. And the scale of the rest of the five criteria is of 0 to 7, which means that they are out of 7. This means that the total points now is 38 points. And you have like 8 extra points, and I believe that this is something advantageous because the criteria are more specific. There aren't like many points like in the overall task fulfillment, for example. What do you mean exactly? So let's look or have a look at them in details to show you what does each of them mean. So the first one, which is the purpose, again, like the overall task achievement, but it's like on its own now. Is it immediately apparent and clear? This is the main idea or the main thing about the purpose. So it's introduced early. Is it introduced early in the document? And is it expanded on later? It's not just about mentioning the purpose, it's about also, uh, let's say, explaining it and giving more details about it later in the letter. Um, it's it should be immediately identifiable. I don't need as a reader to keep reading and reading until I find the purpose or the reason of writing this. It's easy to find and clear. It's mainly about why you are referring the patient to this specific person, why not to another one. This is what it's all about. Okay. Also, there should be specific instructions, and they need to be listed later in the letter. So whether you are recommending some kind of medication, you are recommending discharging, whatever the kind of instructions should be recommended or written later. The second criterion, which is content, it's all about necessary information included and accurate. So here, this was part of the overall task achievement. Now it's on its own. Uh, do you include the necessary information? And is this information accurate enough? So this is what it's all about, okay? And you can find this by these 3 points. Like all key information is included. It's not some. All key information is included. All key information is accurately represented. It's not many of them or some of them. No, all of them or all of it. Are you aware of the audience you are writing to? So you know you are writing to a healthcare professional or to a carer or something like this. All of this is can be found in the content criterion. In general, it's about what does the reader need to know to provide continued care for this case. So it's not why you are writing this letter, it's what kind of information you need to provide the reader with to be able to continue care for this case. Okay. Then we have conciseness and clarity. And this means to be that the information should be relevant and concise. How does the letter omit irrelevant information and summarize the relevant information efficiently and effectively? Or it includes everything? It's about anything that you see in the case notes. So picking the relevant information and summarizing it efficiently and effectively is something which is very important. Um Okay, you write them, you summarize them. Is the summary efficient and good, or the information is not summarized well? This is another thing for conciseness and clarity. So, how clearly is the summary presented to the reader? This is also another way of talking about the summary. And let's say that there is unnecessary information included in the letter. And now this is a very critical point here. So let's imagine that you include some kind of unnecessary information. Here we have two things. Is it distracting? Distracting for the reader. It makes ambiguity, maybe. It makes me not understand the overall Progress. Is clarity impacted again? So if this happens, this means yeah that you will lose marks for including this kind of unnecessary information. Genre and style, and by this we mean written in a manner which is suitable for the intended audience. Again, you are writing this to a doctor, so is it written in a way that a doctor can understand? You are writing this to a parent, is it written in a way that a parent can understand easily? This is the main focus here. Here it says, does the letter have appropriate register? Remember the formality and technicality. and tone for its purpose and audience. So, is it urgent? Is it about discharging? Is it about giving advice on continuing some kind of medication? Whatever the purpose is. Uh, and awareness of the handover document genre. Here you can find like some points. Okay. Uh, are you aware of the type of the document that you are writing? Is it a referral letter? Is it a transfer letter? Is it a letter to a carer or a parent or a caregiver, something like this? Uh, all of this will affect the language that you use. Okay, so this is about how to choose or to pick the language which is suitable, okay, for the genre or the style. Again, like what we said, this will affect the language used. The language which is used needs to be clinical and factual, no judgments. So do not write your point of view, your opinions. No, it's about what you see, about the case notes themselves. They are about the medication, maybe, or the case it's herself or himself, whatever. So do not judge a case. It should also have a professional register and tone. Don't include note form. Do not include bullet points. And do not, or there should be no abundance of short forms, which means do not use them excessively. This is not accepted. Abbreviations and the medical jargon used appropriately, which means that a reader from the same medical discipline, it's okay for them. A reader from a different medical discipline or a non-medical reader. So a reader from the same medical discipline, it's okay to write some abbreviations that both of you know. From a different medical discipline, maybe you write something in your field, let's say as a physician, and you write about something you are writing referral letter or transfer letter to an optician, for example. Some abbreviations are different, so you need to pay attention to something like this. Or you are writing this to a non-medical reader, maybe. So a non-medical reader, if you use abbreviations like BP, we said the blood pressure, maybe they don't know about it. So you have to pay attention not to use abbreviations in this case. You need to use the full word. And again, do not overuse medical abbreviations, even if you are writing to a healthcare professional. This is very important. Remember, it's a letter, and it should take the form of a formal writings piece of writing. Then we have the organization and layout, and this means structured in a way which aids retrieval of information. So does the letter have suitable organization features? Paragraphing maybe, linking words that help me to move from one point to another smoothly and with no limitations or without affecting the general understanding. Here, what we were talking about paragraphing, not necessarily similar to any academic writing. No, it's just about that the paragraphing is clear. Like each point you are writing about is tackled or used and covered clearly and appropriately in a paragraph. Logical organization in the sequence, and by this we mean that you can organize it as the case notes order. It's okay if you find or if you feel that this organization of the case notes will not help you to write it well or in an understandable way. No worries, you can organize them in the form that you feel is suitable. And again, no fixed templates. Use whatever useful and make you feel comfortable. It's okay. Um, the key information is clearly highlighted or no? It's simply it's clear and visible. I can get it as a reader easily, or if I keep reading and reading it, at the end I can't get anywhere. So this is again very important. The layout should be appropriate. So the date is clear, the address is okay, salutation at the beginning okay, closing is okay. But again, there is no one specific layout which is required. And as we said at the beginning, that there is no real uniform layout for a handover letter in the industry, generally speaking, whether in England, Australia, New Zealand, Ireland. So you can choose one that you feel okay with and suitable for the task. No worries about this. And the last criterion we have now is the language. So aids retrieval of information, helps retrieval of information. So does the letter have suitable and accurate vocabulary? Does it have suitable grammar? Is the spelling or the punctuation uh, clear enough and correct and accurate? All of this, all of these things affect the general understanding. Uh, so the language used needs to be accurate, appropriate, and not interfere with reading comprehension or speed. So I don't need to reread or keep reading one line or two lines more than once to be able to understand the general thing. So this was a kind of a general overview of the writing assessment criteria and how they have been updated. And we know now that these criteria have been put in action since August 31st. In the sessions, inshallah, about the rest of the sections and the more details about the writing, we are going to handle how to write in an appropriate way, the kind of structures that you need to use, the language that you may find like tricky, because sometimes again the letter may be sent to a healthcare professional or a carer or a parent or something like this. So also the format, we will find that there are different kinds of format, and every one, each single one even is okay once the task is not affected, and we will know more about this in the course. So I just wanted to let you know, or to have an overview over the writing test, and how it is assessed and what you need to know to prepare yourself for the exam. So thank you for watching, and see you in the course. Bye bye.